Hi, I'm Danielle. I'm a community nurse. I've been qualified since July last year. And before that I was a student at King's College in London. And before that I was a healthcare assistant for nearly 6 years, working in the NHS in different environments. When I started being a student nurse in my first year through to the third year, I saw a really big difference in the services and the resources that we had, mainly within the hospital, because that's where most of my placements were. It went from a place where we had things like working phones to then a place in my final year in certain places where we couldn't afford to buy a phone, where we couldn't afford to buy new equipment like blood pressure machines and stuff because of the cuts. Now that I'm qualified, I work out in the community, so that's a different environment. And because of the cuts, like the cuts to money with like beds and stuff, we're seeing an unprecedented demand on all services, and out in the community our workload is massive. Sometimes we see up to 13 patients a day, and I'm on foot. And this has increased tenfold, the Royal College of Nursing have said, in the last couple of years. This makes your job really difficult. You're with patients and you know in the back of your mind that you need to be somewhere else. And it makes it really, really hard. There's more cuts coming with the sustainability and transformation plans. It's going to cut funding, cut beds, cut services, put more people in the community. We're at breaking point, we can't look after any more people. I don't know how this is going to be sustainable. There's just cuts everywhere. The cuts to our pay, we've lost 14% of our pay since 2010, if not more for some people. People are really struggling, my colleagues are really struggling nationally. It's not a London-centric thing. People are using food banks, people are using hardship funds, people are pawning their possessions, people are using payday loans. A lot of people are leaving. A lot of people don't want to work in the NHS anymore because they don't feel valued because of the cuts to our pay. We've had cuts to nursing bursaries and midwifery bursaries, all the healthcare professionals' bursaries, which has meant they've gone from having a small bursary every month for the work that they do to now having to pay up to £64,000 to train, and this effectively means paying to work, so they'll be paying like over £20 an hour to work if you work it out with the clinical hours that they do. And because of these cuts, we've seen a 23% drop in applicants nationally this year, which is 10,000 students, which in a workforce of nursing that's minus 24,000 nurses, we're heading for a massive, massive crisis.